We're ready to deal with all the 4 stages which the virus may present. I think importantly at this stage, we've seen the virus now manifest in Gibraltar. The important thing is to delay its spread, and that's what we are ensuring we're able to do now.
Is the government going to step up its public information campaign with, for example, adverts on the importance of personal hygiene?
So the best thing that the public can do to help the authorities, in particular to help the professionals in the GHA, is to follow the basic advice about the hygiene that we need to each of us be pursuing. And we will be ramping up the amount of times that we say that and how we advertise that in different locations around town and in all of the general media.
Is the government set to publish a document along the lines of the UK's action plan, and if so, can you outline it?
The government position is that we are going to follow the advice of Public Health England, and therefore the document that you've seen published in the United Kingdom is the paradigm that we're going to be following in Gibraltar, with such changes as are necessary for Gibraltar's circumstances.
Gibraltar is a small community, and we've heard from the Director of Public Health that could make it easier for the virus to spread here. So what sort of measures would the government be prepared to take to prevent this? For example, we've heard in the UK the Prime Minister speaking about discouraging large gatherings and even potentially shutting schools.
The government is considering the possibility of asking people not to have public meetings and not to have other events which may congregate a lot of people together in the early stages of the arrival of the disease in Gibraltar. We'll be making separate announcements about that and other measures that we may take in order to try and delay the spread of the disease through our community.
And in terms of the schools?
So in terms of the schools, the position of the government is that given the circumstances of Gibraltar, closing the schools at this stage would actually probably put more pressure on the GHA than relieve pressure in terms of the spread of the virus through our community. So the current decision is to keep the schools open, but that and everything else will be constantly under review.
Will the government continue to monitor people coming from potentially at-risk countries, and what sort of strain will this put on the border and the airport?
So as the virus spreads throughout the whole world, the areas and pockets of it which we are able to identify will become so many that it will be impossible to have a circumspect approach to those areas where we're trying to stop people from arriving from. And people will be exposed wherever it is that they may go. For example, now, Spain is an area which is exposed, and if you're coming and going from Spain, you would be exposed, and 15,000 people come in every day from Spain. So the attitude is going to be changing around the world, and it will be changing in Gibraltar also in terms of receiving people from different areas.
But for the moment, the current advice for at-risk countries, the 16 at-risk countries, remains in place.
The advice remains the same until it is changed.
Tourism is a major pillar of the economy in Gibraltar. Given that, how will the government try to balance that with the need to mitigate the spread of the disease?
So tourism around the world is obviously going to be affected by people moving around less. We've seen some of the major airlines in the world curtailing the frequency of their flights to some of their most popular destinations. For example, the very popular London-New York route is being somehow reduced. So this is going to be an important consequence of the virus, but the first action of government must always be, our first duty must be to keep our people safe and to keep our communities secure, and of course that's going to be the most important aspect for us when we come to consider this virus.
Have extra funds been released for additional training and equipment in the hospital, and could this come from the rainy day fund?
There's always a provision for contingency in the estimates for every department. In the GHA in particular, there are contingency amounts provided for, so that as needs drive the cost of the GHA, that amount is made available. Alternatively, a supplementary provision can be made, so funding will not stand in the way of the GHA having all of the resources that it needs for these purposes.
Have some of those funds and resources been allocated already towards tackling this? For example, we've heard about the need for more equipment.
None of that has yet required any reference to supplementary provision, because the GHA has already a contingency fund in the annual amount given to it, but if it became necessary, of course, we would make the monies available.
There could be a significant strain on emergency services if the situation worsens. How is Gibraltar preparing for this?
So what we're going to do is we're going to ensure that by delaying the spread of the virus, we help the GHA to deal with the issues by, as a community, following the advice of the Director of Public Health and of the GHA in doing the things we need to do by washing our hands, being very careful about our hygiene. In that way, we stop the spread of the virus. If we need to bring in extra staff, we shall do so. If we need to ask people to come back into the health service to assist us when they have retired, for example, the bank nurses that we've had before, we shall do so. But at this stage, I think the important thing for each of us to do is to do our little bit. And our little bit is simple. It's washing our hands, it's not having contact with others, it's protecting those in our family that are within the vulnerable categories of individuals. Those are the things that help the GHA the most.
A statement circulating in the elderly residential services backing up the government's statement yesterday that visits will be restricted also suggests that the premises could be closed to visits entirely if the situation worsens. Is this envisaged?
We've not yet made the decision that we have to close the elderly residential services to visitors. We don't want to do that. Of course, we want our elderly residents to be able to have the visits of their family members. But if protecting the lives of the majority in the residential facilities requires us to lock them down, so to speak, we shall have to do so, but we shall do so only if that is the advice of the Director of Public Health, and indeed if that is the position that is taken in other jurisdictions in order to provide that extra layer of security and safety.
We've seen concerns over panic buying and pharmacies running out of hand sanitizer, for example. What measures, if any, is the government taking to ensure Gibraltar's supplies and supply chains are robust and flexible enough to handle this?
Gibraltar's supply chains are not going to suffer as a result of coronavirus. There's absolutely no need for people to panic buy. People sometimes overreact to news. It's important that the first ally of dealing with this virus is to keep calm, to follow the advice of the government. People don't need to run out and buy things. What they need to do is wash their hands, and what they need to do is follow personal hygiene advice, which is basic and you would expect all of us to be following. But that is the best way to help the GHA, and indeed it's the best way to help your family. So don't go out and buy many tins of baked beans, because that's not what you need to do. What you do need to do is wash your hands when you sneeze, bin any tissues and cough into your sleeve. That's the important thing to do.
If human nature means that people still will go out and buy those tins of baked beans, what measures can be taken to ensure goods can still cross the frontier? I mean, obviously this is taking place against the backdrop of Brexit. You've spoken about goodwill with Spain in the recent technical meetings, and especially given if Spain has its own potential issues with supply chains as a result of this, how will Gibraltar ensure that goods still come into Gibraltar?
There is no known cure for human nature or journalistic overexcitement, but the important thing is that people should know that there will be absolutely no effect on the supply chain, that the relationship that we have with Public Health England is a very positive one, and we're communicating through them to the international and European reporting authorities. We've established communication with the Spanish public health authorities as well. Therefore, there is a very fluid communication. There is no need to think that there is going to be a break in the flow of goods across the frontier, or indeed in the flow of people across the frontier. So we must keep things in perspective, and we must therefore react to the circumstances as they are today and not extrapolate more dramatic circumstances out of what we're dealing with, because the GHA is dealing with this very well indeed. We have one known case in Gibraltar. That number may likely grow, but that doesn't mean that we are in any way going to have to resort to panic buying or any of the concerns that are being raised by many on social media, etc. I understand that people have those concerns, but look, the government has put the information out there as soon as we had it. If we felt there was a need to advise people to do something different, we would.
One potential drastic scenario extrapolated by the UK Prime Minister in his action plan is that there could be shortages of up to a fifth of the workforce if the situation worsens and more people get sick. What sorts of measures would the government have to put in place to help businesses in that scenario?
It's impossible for us to be able to predetermine what those losses might be, and therefore if we were to give any open-ended commitment, it would not be worth the air in which I utter the words. Let's be realistic about what it is that we need to do. We need to deal with the situation on a day-to-day basis. The whole process of seeking to delay the spread of the virus is not just to put less pressure on the GHA, it's also to put less pressure on business and on the government itself as an authority that needs to continue to function. And what we need to do for those circumstances not to manifest themselves at their worst is to follow the advice to ensure that we each protect ourselves from each other and from the virus. The virus is carried by other persons, and so we protect each other by ensuring that we wash our hands, bin our tissues and cough into our elbows.
Is there a chance this could affect the timing for the referendum, given that it will be a significant public gathering?
So at the moment, the government is not considering postponing the referendum. We will have to consider in coming weeks whether it is necessary to postpone, indeed whether it is possible to postpone the referendum. I think we will have to take measures in the polling stations to ensure that there is sanitizer, etc. But at the moment, we would say that the referendum should go ahead.
And how does the government propose to reduce panic and reassure the community?
I think the important thing is to tell the community that they heard about this case from the government. The government is not trying to hide from people that there is a case of coronavirus in Gibraltar. If there are 2, if there are 20, and if there are 30, we will be the ones telling you. So you don't need to panic because you've read something on social media. Look at what it is that the official sources of news are saying to you, what the GHA and the government are saying, and what the established media, the trusted media, are saying, rather than simply pursuing the thread that might be most alarmist on social media, that might have been put up there by somebody wanting to achieve some notoriety. We will tell you if there are more cases. We will tell you if there are things that you need to do. Our first duty is to keep you safe, and therefore we won't be hiding away from any problems if we need to give you more information. For now, there's absolutely no reason whatsoever for people to do anything other than follow the very basic, and it's very boring to repeat, but very important advice: to bin their tissues, to wash their hands thoroughly, and not to expectorate over anyone, and so therefore cough into your armpit or your elbow.